Hello and welcome to this short video about Cardiff Nursing Future's Bachelor Nursing programme, which starts September 2012. My name is Kate Greenoff. I'm the lead academic for placements within the School of Nursing here in Cardiff, and I'm helped in this video by Janet Keggy, who's a clinical teacher from Cardiff and Vale, and Jean Dad, who's a practice facilitator from Aneurin Bevan Health Board. Together we hope that we will answer some of the questions that you've been putting towards us about the new programme and help you to be able to support students.
Can you explain why there is a change to the programme?
In September 2010, the NMC published new standards for pre-registration nurse education. The focus of these standards is that registrants should be able to provide essential care, that's essential physical and mental health care, to people of all ages. In addition to this, they need to provide complex care to patients within their own field of practice.
Is my role as a mentor going to change?
No, your role as a mentor will remain the same. You're still accountable for assessing the 50% clinical component of the nurse education curriculum. Remember that you are the gatekeeper to the profession. Your role is key in assessing whether the student has achieved clinical competence in order to register with the NMC at the end of the programme.
Was there any consultation with clinical practice?
Yes, there was lots of consultation. The NMC gave consultation opportunities to all registrants whilst they were developing the standards. The All Wales group also had lots of consultation with practice, also with patients, with public and with students and academics. Locally, we again had lots of consultation with our practice partners both at a strategic level and within clinical practice. This included mentors. We also consulted with students on the current programme, and we were actually commended about our consultation with the public and patients who will actually be nursed by people who have come off this programme. So yes, lots of consultation.
Will this affect students on the old programme?
No, the students on the present curriculum won't be affected. The last cohort of students undertaking the present programme commenced their programme in March 2012. This means that we're going to have two programmes running side by side until 2015. So as a mentor, you need to be aware that your student may be on the current programme or they may be on the new Cardiff Nursing Futures programme.
I have heard that placements are going to change and there will be hubs and spokes. What does that mean, and what do I need to do to support the student?
There will be hubs and spokes. The hub will be the main placement that the student will be allocated to, where their designated mentor will be allocated. The spokes are designed to give the student a breadth of experience across all fields of nursing, to include adult, child, mental health and midwifery.
Will the documentation I complete change?
Yes, there will be some changes to the documentation. The competencies have been set by the NMC and there are generic competencies, and in addition there will be field-specific competencies. All the students' documentation will be bound and will be presented in a student portfolio for the whole 3 years of the programme. The self-assessment and action plan has been changed to a practice learning opportunity preparation. The student mentor learning contract is very similar to as it is presently, but you will notice that there is a further feedback form, and this is for you to comment on any additional commendations or progress suggestions for the student to take to the following practice learning experience. You will also notice that there's a section where you can comment on the student's attendance and punctuality. The assessment of professional attitudes is very much the same as it was before, but now it's 1 to 6 on the Likert scale. Students need to achieve at least 3 for each of these, and this is actually a summative document. There is a new service user carer involvement form, and this form enables patients or user carers to comment on the student's practice. The additional practice learning experience record is an important document. This is the document that the student needs to use when they go to a spoke placement. So remember that you could well be a mentor for a student in their spoke placement, and this is the form that you need to complete. This form also needs to be completed if the student spends some time with another health professional at a clinic, specialist nurse, or any of those sorts of opportunities. And it's very important as a mentor that when the student returns to your area, you actually look at these forms, because anything written on these forms can then be used to feed into the practice assessment document. The format of the clinical practice assessment document is very much as it is at the moment, with a few differences. First of all, you will note that the extreme right hand box is also grey. So now if a practice outcome has been achieved, all the grey boxes need to be signed by you as the mentor. You'll notice that the progress towards but not achieved box has now been removed. However, there is still room for you to write a progress statement if you feel that the student has made good progress towards an outcome but hasn't fully achieved it. You'll also notice that there are now 3 methods of assessment. The 4th method of assessment, which was section 2 of the student portfolio, has now been removed.
Does the practice element count towards the overall mark for the degree?
Yes, this is something that came out very strongly in our consultation with mentors and students locally, that they wanted not just a pass mark for practice, but the students' performance to be reflected in their overall mark at the end of the programme. In the Cardiff Nursing Futures programme, the portfolio of evidence from practice is what is going to go towards the end mark for that student. So practice will come through into their final classification. Students will have to have passed all practice outcomes. They had to do that before. But if they don't do that at the end of the year, then it's a referral. Students will have to have a mark of 3 and above in their professional attitudes. This is now summative, whereas it was formative prior to this. Students will be given some time in practice, 2.5 hours a week, to reflect on that practice. That too goes towards their final award. And your comments made in the learning contract will go towards the final award. This will all culminate each year in one module that is related to practice. So again, don't worry, we're not asking more of you. We're just asking you to continue what you've already been doing. It's us as personal tutors that will actually be marking the portfolio.
What support can I expect as a mentor?
Okay, the support that you will have in the role of mentor isn't going to change. In an Iron Bevan Health Board, the practice facilitators are there to support you. In Cardiff and Vale, the clinical teachers are there to support you. We also offer 4 NMC updates that will support you and give you any additional information. Within the university, you have the clinical director for placements, you have the link lecturer, you also have the personal tutor. There are also web pages within each health board where you can access information in relation to your role as a mentor, where there will be frequently asked questions answered on those sites as well. There's also the CPSSU web page from Cardiff University, which will give you a lot of information in your role.
If you do have a question, please don't hesitate in contacting either myself, Janet, Jean, or our colleagues within the university, and you'll see our names, faces and contact details up on the screen now.